Does the temperature show immediately you get infected? The answer is no. Do the symptoms appear immediately you are infected? The answer is no. Symptoms, including temperature rise, appear some days after you have been infected. The minimum is 2 days, but it can go as far as 7 days. So the symptoms take long to develop, and that's why we say it's important to avoid exposure because you may not know who is infected. Now, which symptoms? Yes. The temperature that would cause alarm is a temperature above 37 degrees centigrade. About 38 and above would cause alarm. But that is what they would define as fever. But are they helping a lot? Not so sure. Now, so the symptoms appear late, and that's why we said don't expose yourself. And yet, a person can transmit the infection to somebody else even before the symptoms appear. Christopher, what is Uganda doing to ensure that people are getting treated properly? What the doctors are doing and the nurses are doing is to get the patient early. That's why we are very much interested in tracing to see who is infected, because when you get them early before complications have started, then the success of treatment is much better. What are the doctors using? They are essentially using every possible life support system for the patient. Um, better food, uh, nutritional supplements, uh, use of some drugs. The people that have got fever, you treat the fever. You give treatment to reduce the coughing. Uh, you, we also are using the hydroxychloroquine to help the patients. So we essentially are doing, our doctors and nurses are getting in early, and they're giving every possible support system to prevent the patient from getting into the breathing failure, which is the main cause of death in the patients that are dying from COVID. So that so that's what is happening in the hospitals. Now we have found that um, people that get to the level of requiring support are the ones that have got underlying problems like cancer, like diabetes, uh, and like high blood pressure. And then you need to manage also those well, so that, because if you manage those underlying conditions well, you help the patient to recover from the infection. Um, testing system. The testing system at present, we use the PCR, which is a DNA test. It is the most sensitive test, which is recommended everywhere in the world, and Uganda has got an efficient system for doing this, and our Uganda Virus Research Institute is very well equipped to handle the diagnosis. Now that use of the PCR has been decentralized. Other laboratories are being opened to provide the diagnosis using PCR, so that we reduce the turnaround time. There are other tests that are also being used. Um, The RDT, the antibody test you are referring to, is this a test which detects whether the patient has produced antibodies to the virus? And one of those tests is what you were asking about, which has been developed with collaborating scientists and biotechnology companies outside the country. That test can give results within 5 minutes. It's been evaluated, and it is ready to go for field trial. Cattle in Cairo. The Hunter's virus, the coronavirus, there are many coronaviruses, but the one that we are interested in right now is the coronavirus, which was diagnosed detected in 2019, which causes disease in humans. The other viruses are there. There was one which was SARS, and they expect some more to come because these viruses live out there in wild animals and birds. So Hunter's virus will be one of them.